My name is Nirav Patel. I'm a pediatric gastroenterologist with Atlanta Gastroenterology Associates.
My name is Dr. Tejas Mehta. I'm a pediatric gastroenterologist at Atlanta Gastroenterology Associates here in Atlanta.
We treat a variety of gastrointestinal disorders. We see patients all the way from infancy to childhood to adolescence, and we treat a variety of disorders which encompass digestive disorders, nutritional problems, and liver problems, some of which include constipation problems, diarrhea, gastroesophageal reflux, feeding problems in infants and older children, problems such as celiac disease, irritable bowel syndrome, food allergies, inflammatory bowel disease, just to name a few.
In my practice, my philosophy is to take a family-centered approach. When you come into my office to see me, my first and most important thing is to get to know your child and keep your child and put them at ease, as coming to a doctor for any child of any age is a nervous and sometimes terrifying experience. As we get to know the child and as we get to know the family, we will discuss the digestive issues during the course of our visit, and at the end of it, come up with a treatment plan that the patient and the family is comfortable with.
Some of the more common issues that we see depend on the age of the child. So some more common disorders we may see in infants and newborns include things like gastroesophageal reflux, and cow's milk protein allergy, and food allergies. As the child grows into toddlerhood, we start dealing with concerns about weight, failure to thrive, diarrhea, and older children may start to complain of chronic abdominal pain problems, diarrhea, gastroesophageal reflux disease. We also see something called eosinophilic esophagitis quite a bit. And as the child grows into adolescence and older children, we also diagnose a lot of irritable bowel syndrome and inflammatory bowel disease, things like Crohn's disease and ulcerative colitis.
Nutrition is a key cog in what we do in our pediatric gastroenterology practice. Certainly in babies and infants who have milk allergy and who are basically reliant on their formulas, allergy issues can be addressed and symptoms improve quickly. Frequently as children get older, unhealthy diets, including not eating enough fiber, not drinking enough fluids, can lead to issues such as constipation. We also frequently see food allergies, and as kids get older, intolerances to certain things such as lactose and other sugars such as fructose can lead to gassiness, abdominal pain, something we call irritable bowel syndrome.
For me, the most gratifying part of practicing medicine is seeing results. When I'm presented with a child who has a chronic GI condition, it can be quite debilitating. It may negatively impact the child's quality of life in a very profound way. And to be able to nurse that child back to health and see results, that's extremely gratifying. It personally brings a lot of joy to me, and to be able to bring to the family something they were missing for a long period of time. And as a parent of children myself, nothing brings greater joy than to be able to see results like that and to be able to connect with the family in a very unique manner.
The most gratifying part of my practice is to see a child who comes in, who's suffering, who's having issues that affects their quality of life, it affects their family's quality of life, and for us to be able to determine a cause, come up with a treatment plan, and in time have them come back and see me smiling, happy, active, running around. And that's why I do what I do. If we can be of help to you and your child, please contact our practice, Atlanta Gastroenterology Associates Pediatric and Adolescent Division. We are available to see patients Monday through Friday. We can see patients same day if necessary.